All right. Okay, so hi everyone. Thanks for joining our Q3 Stop TB Canada Steering Committee meeting. We have about 90 minutes to, as we usually do, kind of reflect on the work of the network over the previous quarter, talk about ongoing projects and ideas, and look ahead to the next couple of months, kind of identify our priorities and key activities that we want to engage in. As always, these meetings are just recorded for note-taking purposes so that the members who are not here today can go back and catch up on our discussion, or you can go back and revisit anything that we've talked about. And as always, feel free to just jump in, raise your hand, use the chat if you want to add anything or have questions throughout the call. But to kick us off, I'm going to pass it over to our co-chairs for a little bit of a welcome. And Tina, over to you first.
Thank you, Lee. Hello, everybody. It's a pleasure to welcome you to this quarter's Stop TB Canada Steering Committee meeting. My name is Tina. I currently sit as co-chair alongside Petra, who will have a few welcoming remarks following me. So whether you're joining us for the first time or you've been a longstanding member of this amazing and inspiring group, thank you for making the time to be here today, especially in the middle of summer. So as many of you know, our work brings together a dynamic network of advocates, researchers, clinicians, policymakers, Indigenous health leaders, and people with lived experience. This diversity of expertise is what gives our group its strength. We are united by a shared goal, TB elimination. Stop TB serves as a voice in both the domestic and global movement to end TB. TB, of course, remains one of the world's deadliest infectious diseases. And while progress has been made, we know that millions still lack access to diagnosis, treatment, and care, particularly those in marginalized and remote communities. That is why our advocacy efforts are more important now than ever. We must continue to push for equitable, sustained access to TB services, increase domestic investment and accountability in reaching Canada's commitment to end TB by 2030. In Canada, TB continues to disproportionately affect certain populations, including Indigenous communities, as well as newcomers from TB endemic countries. A TB diagnosis can be life-altering, and treatment is long and demanding for those with drug-resistant. And for those with drug-resistant TB, the regimen is even more complex and grueling. Beyond the medical impact, TB carries a heavy emotional and social burden, fueling stigma, isolation, and economic hardship. Successfully addressing TB requires deep collaboration between governments, public health agencies, community organizations, communities, and individuals. It also demands culturally safe, community-driven approaches that center equity, trust, and sustained investment. And here at home, we are heartened by the signs of progress. We want to take a moment to celebrate some truly hopeful news, as reported recently by CTV and CBC. Nunavut had declared the end of 2 longstanding TB outbreaks. These outbreaks lasted several years and posed serious challenges to the affected communities. The successful resolution is a testament to the strength of Inuit leadership, community-based health efforts, and the dedication of public health professionals working on the ground. So congratulations to all involved. This is an important and encouraging step towards TB elimination in Canada. But still, our work is far from over. We must ensure these successes are sustained, replicated, and supported by long-term commitments. So let's continue to raise our collective voice and push for smarter policies and stand firmly beside the communities most affected. And with that being said, I'll now pass it on to my co-chair and friend, Petra.
Thank you, Tina, for that beautiful, thoughtful opening. Fully resonating with that, I just wanted to kind of give a little bit of an overview of what is happening in the global context. I think many of you are aware that we've talked about it in the last meeting as well, in major political and geopolitical financial shifts that are happening, led by changes in the US, have also impacted the TB community really harsh. And TB communities around the world are seeing dwindling resources, dwindling financing. Impact is not just in newer kind of opportunities, but it is also impacting, for example, the Global Fund current grants, which many of countries, like up to 60% of our high TB burden countries, rely on. So a big effort is underway on reprioritizing, realigning what the current grants are, and creating efficiencies, as it is kind of suggested under guidance from the Global Fund within the current grant, while they are also looking at replenishment for a next grant. So those constraints on TB programs, while they feel incredibly overwhelming for many people, there's lots of job losses. There's, of course, pressures on programs to, with much smaller resources, contain and continue supporting those that are affected by TB. The problems are not going to go away. The problems are seem to be increasing, of course. That is the result. So I think it from our side, from Stop TB Canada, that means that when we are looking at future advocacy on our government, it will mean that our language is more on really encouraging the stepping up, the leading further from Canada to Canada, a country that is really aligning with solidarity and many other values globally that do look at supporting high TB burden countries. So from that point of view, we're hoping that Canada will be able to bring other countries along and create those partnership and alliances to support the global health and TB efforts around the world. And so I think we'll hear more about that in today's agenda. There are, of course, also many positive developments in the TB space that are happening, and that's particularly related to research and development. New TB diagnostics are in the pipeline that are very exciting, and being able to bring testing closer to communities. TB treatments are becoming shorter and shorter, and there are vaccines in the pipeline that are very promising. All of those are currently not accessible to Canada. So another reason for us to really keep the advocacy efforts up, to also make sure that Canadians can benefit from many of these new developments. So we have our work cut out for us as a group. And I'm also pleased that we will be talking in today's agenda how our own network is professionalizing. So I won't talk to it fully. I'll let Lee take over from here. And Tina, thank you for setting the stage so beautifully. And Lee, over to you.
Thank you both. I think that was a really great overview. And sometimes we just dive right into our priorities, but it's nice to just kind of take a bit of a bird's eye look at the environment that we're working in and the importance of our work. So great job, everyone. And maybe hopefully that was helpful for you, Kins, as well. So for everyone who doesn't know Kins, she has a meeting with Tom Wong and some others shortly, and is just listening into our call today to learn a bit more about our advocacy. I don't know, Kins, if you want to just briefly introduce yourself to everyone on the call.
Hi, everyone. I'm Kinzo Liman. I lead a not-for-profit company in Pakistan, and I'm a passionate global health advocate. We are grateful for a lot of support that we get for our innovative interventions from Global Affairs Canada through TB Reach, the Stop TB Partnerships mechanism. And I am trying to share the learnings thanks to the Canadian support back with the Canadians, because we really believe that some of the innovations and interventions that we have done and the results that we have achieved can really sort of be useful for Canada as well. Over. Thank you very much for letting me join the call.
Thank you. Okay, so I'm going to share my screen. And get started. Okay, so for our agenda today, we're going to be covering the following topics. I know a few of you do have to leave before the 90 minutes are up, so we'll see how much we can get through. I'm going to start with just a really quick report back from Q2, as we usually do, some of our key activities and outputs over the past couple of months. Then we'll shift to our typical updates from each of the working groups. We'll talk through our Lead on TB campaign, which we have started talking about in various meetings, but haven't really gone into detail as a full group. So we'll talk about the Lead on TB campaign and some of the events that are being planned for September in Ottawa. And then we're going to be joined by some guests from McGill to talk about their TB cab and how Stop TB Canada can be involved. And then if there's any time at the end, we can open it up for any other business. So I'm going to start with a quick look back at the activities and some of the work streams that we advanced in Q2 of this year. So in April, as usual, we published our annual report, which highlights our network's activities and impact over the past year. And let me just see if I can get the chat back up. Sorry. Oops. Pull this over here. There we go. Now I can put things in the chat at the same time. Sorry. And then in Q2, we also had our abstract on access to medicines in Canada accepted as a poster presentation for the Union Conference on Lung Health this fall. Our access to medicines advocacy also may have contributed to McLeod submitting a request to Health Canada for its rifapentine to be reviewed. So we know that a 300-day review process was initiated in March, and we're tracking movement on that, and we can come back to some of our follow-up activities on access to meds shortly. We had a few publications from steering committee members this quarter, including Petra's blog on the Stop TB Canada website, where she shared some G7 reflections, and Robin's article in The Diplomat on the deadly effects of USAID policy, or Trump's USAID policy. So I'd encourage everyone to check those out if you haven't already. And then also just kind of a reminder that the Stop TB Canada blog is really open to any Stop TB Canada steering committee members. If you feel passionate about a particular topic or you want to write a short blog on some, it's really open to anyone. So please reach out if you have something that you'd like to publish on the website. And then lastly, I just wanted to flag that we have officially created a Blue Sky account to add to our suite of social media platforms that Stop TB Canada is on. And then we're also trying to be a little bit more active on LinkedIn. So go find us on both of those platforms if you haven't already. And I just wanted to open it up to see if anyone wanted to share anything from Q2. So April, May, June, that's worth sharing or celebrating with the network. Okay, great. I got it all covered then. So I don't see Robin on the call. I'm not sure if anyone has heard from her, but I will shift things around maybe. I was going to do the operations working group update first, but let's just start with the global working group, and then we can come back to operations if she comes, or I can cover that if she's unable to make it. So in terms of the global working group, as you all know, we're currently focused on our Global Fund replenishment campaign because the Global Fund is the largest international financing mechanism for TB. Stop TB Canada and TB People Canada are both members of our 24 organization coalition in support of the Global Fund's campaign. So we're all working together to influence Canada's investments towards the 8th replenishment. So far, as a coalition, we have sent a letter to Minister Sarai and Minister Anand outlining our ask. And our ask is $1.37 billion, which is basically an inflation adjustment maintenance pledge from the 7th replenishment, but it also gives some room for a potential TB set-aside. And for those who aren't familiar or who haven't been on some of the global working group calls, Canada is considering to include basically an earmarked amount within the 8th replenishment pledge that would go specifically to TB programming. We don't know yet if Canada is going to include this, but we have shared some information with GAC on how they could channel these funds if they do go with this option. So if they do a TB set aside, here are the different programs that we think would be most impactful to include in those investments. We also have a first meeting with GAC on the Global Fund since the election next week, where we'll be covering our ask and hopefully get a bit more insight on what they're thinking in terms of the pledge and the timing of a pledge and the set aside and all of that. So I'll definitely keep everyone posted on any intel that we gain from that meeting. And then in addition to the Global Fund letter that we signed on behalf of the coalition, Stop TB Canada also sent a letter to Secretary of State for International Development, Randeep Sarai, and Minister of Foreign Affairs, Anita Anand, outlining our global asks. And this is part of our network's post-election outreach, where we're sending letters to all the relevant ministers outlining the asks that are relevant to their mandates. So for the letter to the Secretary of State for International Development, we included our global asks that we've been pushing for a while now, including the Global Fund, TB-R&D, which includes TB Reach, and then we've also added an ask to support the Challenge Facility for Civil Society, which is a Stop TB partnership program that has been really impacted by USAID cuts. So we did include a meeting request in the letter as well. So I'll keep everyone posted if I do hear back from the minister's office. So hopefully we'll have a chance to introduce our network and talk about how Canada can be supporting on global TB elimination. Does anyone want to add anything on the global side, whether it's relevant to activities we've done as a network or just kind of updates to share? I know there's been a lot in the news that Petra touched on in her opening, but just wanted to open it up and see if anyone had any thoughts on what we could be doing outside of the work that is already being done by the Global Working Group. Okay. No worries. Okay, so I am going to move on to the domestic working group, and in the meantime, I'll just shoot a message to Robin and see if she's going to join for the opera. Oh, you did that, Petra. Okay, amazing. Thanks so much. So then I'll pass it over to Lena to kick us off for the domestic working group. Feel free to include things that were not on this slide too, Lena. I'm not fully updated on everything that's happening in the domestic working group. So go ahead, over to you.
Thanks, Lee. Yeah, so we have also been drafting letters to various ministers, including Health, Immigration, and Indigenous Services. We've shared the drafts with the domestic working group, and so hopefully we're hoping to finalize those by next week. And then I think we can move on to the next slide unless there was anything else there, but I don't think so. Yeah, and the other main parts of what we're doing right now is advocacy around access to medicines as well as diagnostics. So for the access to meds piece, as you all know, well, not as recent anymore, feels recent, but we published a report earlier this year on access to medicines for TB, and are now working on doing more targeted outreach using this report. Yeah, so we're going to target the Parliamentary Standing Committee on Health, as well as I think other MPs that we've identified as being sort of relevant to TB advocacy. And I think Nancy, I'm not sure if Nancy's on the call, has also been working on a letter to the CPHO. Oh, this is a different one though, CMHO.
I might have just gotten that wrong. I was
okay, CPHO. Yeah, I think Nancy's one was the CPHO, and so the final thing that we've been working on is a new survey on access to TB diagnostics. I think that's on the next slide. Yeah, so we've identified a subgroup of people who are interested in working more closely on that, and so we've had 2 meetings with this group so far, which we basically used to draft a survey asking about barriers to accessing diagnostics for TB. And so we have a draft of the survey now, which we've also shared with the entire domestic working group, which we also hope to finalize towards the end of this week, next week. And then we'll disseminate similarly to the Access to Med survey. And the goal is to have a similar sort of advocacy output the way that we did for Access to Med, so a similar report that's shared with stakeholders. Thank you. I think that's all from the domestic side.
Okay, I'm gonna stop sharing for a second and just see. I think that there have been a couple of threads, email threads on potential additional advocacy activities on the access to meds piece, and I just wanted to make sure that everything that we've talked about doing is either being actioned or we can have a bit of a game plan. So particularly on the pediatrics, is there anything that's outstanding, people that we should be connecting, or where did we land on that?
I don't know. I'm not sure whether these were things that were started while I was off, but I haven't seen emails specific to pediatrics. So I don't know if someone else had been working on that, but not me.
Were you think I'm just trying to remember what was discussed. I feel like there were some kind of brainstorm ideas tossed around, maybe about like trying to connect with, affected families or patients at one point, but I think it's sort of at a standstill unless there is someone who kind of identified someone that might be willing to share their story, like in a video format or, an article. Is that what you were thinking of, Lee?
And I think there was a conversation about like connecting with TB Alliance or some others to see if we could move forward with like the conversations with Health Canada. Just because I think the pediatrics piece was particular, like it resonated from the Access to Meds report. It was one of the key messages that was reported on and seemed to get a lot of traction. Petra, and then Elizabeth.
Oh, sorry. Yeah, go ahead. I was just gonna say, is this something that Molly might know about or have been working on?
I don't know if anyone's been working on it. I think it was just like it came up like, oh, we should continue pushing this.
Okay.
So just a few pieces on this. Health Canada mentioned that they had a general access to meds piloting going on for pediatrics. And so we pushed at that time in the conversations with Health Canada that TB could be part of that piloting. In a recent rather formal communication by email with Health Canada, I prompted that issue again, wanting to know what their follow-up is on the pediatric access to any medicine and whether TB could be part of it. We haven't heard back, but I see that as an opening towards the formalized communication with Health Canada, which is more of a slower process. On other kind of partners, we did indeed have a conversation with TB Alliance with ISK. We also had through Unit 8, who are very keen to helping us with this. So they are on continuously reaching out to their government relationships, government relations within Canada as well. They're very keen on making things move within Canada. So both those two, and I know that GAC has hosted a meeting with GDF for Health Canada and ISK earlier in the year. So these are the three external partners, GDF, Unit 8, and TB Alliance have all used their own kind of mechanisms to pressure Canada from the outside. I think it would be good in this quarter, this upcoming quarter, to pull those different groups together or at least check in with them individually or somehow organize maybe a discussion forum where all three are, where we put Canada, Health Canada particularly a little bit on the spot on what is currently happening and how do they respond. And I think the having these international players with us will give it more credibility or will call Canada a bit more to account. So I would use their voices to bring this issue up. And then at the same time, as working group, have something concretely ready. Like you were alluding to, Madeline, we talked about kind of having a photographer or a journal, like a photo journey, storytelling around maybe one or two case stories. If we can identify a few of those stories, that would be great because then we can also do something concrete with it. So these were just a few things to catch everyone up on what I think we know about this area.
I was going to pick up on something that Petra already brought up, which is that meeting with Indigenous Services Canada, because that feels like the other like big group at the federal level that has a big vested interest in trying to get access to pediatric meds. But I kind of lost track since that meeting with TB Alliance, and ISK when we put them together. So I was going to ask if anybody else had any news from ISK since then, because if not, that's something else that we should follow up on, and try and do our best to sort of coordinate with whatever ISK is trying to do internally at the federal government, and put pressure on the same points.
So just to jump back in here, Elizabeth, so KINS has been invited to speak to the RMO and Liaisons Network in half an hour. And I'll be there as well. So I'll bring this up. I have a few closing slides that are kind of bringing them up to speed what Stop TB Canada is all about. And one of them is the access to TB meds. One is talking about surveillance in general with it. So I'm bringing up some of our generic calls. But I'll specifically mention the pediatric medicine in when I speak to our advocacy report. And Lena, I will also bring up, because KINS is mostly speaking to projects that are related to newer diagnostics, but also bringing up real-time data and surveillance and many other issues that are relevant to our First Nations and Indigenous populations. So I think it will flow really nicely into all our calls, and I will bring up the diagnostic survey as well. It's as an activity what we're doing on behalf of Canada.
Just to add one thing here, also discreetly touching on how dispersible medicines and the short-term regimens are helping us in Pakistan in increasing our treatment uptake and our treatment success rates. And then Petra will close the loop in terms of how Canada can access those, so on and so forth. So we hope that this will work.
That's great.
Super.
And I think that call is open, right? Petra, you shared it with the group to listen in. So if anyone's interested, we're kind of going through this agenda quickly, so we might actually be able to join that call, but we are expecting some guests to join. Maybe I can write to them to join a little bit earlier. They're supposed to come at 12 to talk about the McGill TB Cav. Did we want to touch on anything for the diagnostic survey, Lena, or is the main thing just everyone review the draft questions? Is there any timeline that you're thinking for this project, or any other support that's needed?
No, so I was just gonna give people the rest of next week just to give comments, because I think Melissa said, Melissa and Simon's group, who also wanted to give feedback, I think she said she was away for the rest of next week, so was gonna provide feedback when she gets back. So I didn't want to put too much pressure. So I think, yeah, as long as we can get feedback by the end of next week, then I can incorporate all that feedback, and then we can have a first draft, which I think Nancy had mentioned could be piloted among some of her colleagues, just to see how we're doing with the questions and if they make sense to people. And we might be able to think of other examples of people to pilot it amongst. And then after the pilot, we would kind of get a finalized version and start planning dissemination.
Sorry, rather than piloting, I was just thinking of getting feedback maybe from a couple of people.
That works too.
Piloting
Yeah.
I don't know if I could ask them to do that, but something along those lines.
Awesome. Yeah, that'd be awesome. And I guess if anybody, that would be sort of more the nursing, people with a nursing background. So maybe we should do a similar kind of thing in colleagues with a laboratory background, because I think we decided to branch the survey into different audiences, so clinicians, laboratory people. So yeah, it might be good to get feedback from those two groups. Yeah. Thanks, yes, and yeah, it would be great to get your feedback as well. Your colleagues' feedback. Yeah. From both. It would be good to have feedback from different audiences, and especially people that are not part of the group who put this together, because I think having external feedback would be helpful, just to make sure we're not missing anything. It would be good to have a few lab people as well. Thank you, Yasin. So in terms of general timelines, I don't want to put a deadline on it right now, given that we're still drafting the survey. But once we have a draft, then we can think about more timelines in terms of how long we're going to have it open, and then how long it'll take to analyze the data and everything. Yeah.
Okay, sounds great. I don't think there needs to be a hard deadline or anything, but just let me know in terms of dissemination. I can obviously include it in newsletters and share it with Sharanya for social media and all of that, however you want to share it. Yeah, so that's great. Keep us posted.
Awesome.
Okay. Anything else on the domestic side that we want to touch on, Petra?
Yeah, just one more thing. We've been invited by the the Migration Network. I'm blanking on the name at the moment. They have a 3-day meeting in September, which coincides with our TB Hill moments. I will get the exact name in a second. But based on the presentation that Mikashmi and Kins and I gave at the CTBEN on new TB diagnostics, they are having a 3-day meeting that also looks at tuberculosis, or mainly looks at tuberculosis, I think, migration and immigration. I'm still looking for the exact in my email box. Hang on, I'll get it. Anyway, they've asked us to come and present. Specifically, they're interested in digital technology and AI for their own discussions. And I think this aligns very well with our recommendations around improving TB screening for high-risk populations. So I think all the recommendations that the working group has, or that we have in our domestic calls to action, we will for sure be able to align them in that presentation. So this is a great opportunity again to put our asks forward, and also Luce's paper might be nicely timed around. If we can get that out around the same time, it might be a really good moment to get some wider advocacy. But speaking at that conference to reach the wider network will kind of further push the messages that we're also trying to put out to the Minister of Migration, Immigration. So yes, thank you, Kins. That's perfect. Thanks so much. That's what I wanted to add. So it's on the 25th of September. So looking forward to working with the domestic working group on getting the presentation right. And if anyone from the group is knowledgeable in this area, happy to put you forward as speaker.
Great, thanks, Petra. And the 25th of September is also our TB Hill Day. So for anyone who's going to be in Ottawa for that, might work out, assuming that's in person. Okay. Anything else to flag? Okay, great. Thanks, Domestic Working Group. Robin, I've seen that you've joined and left a couple times. So wondering if you're here or you're having internet challenges.
Yes, I'm here for now. I'm in an airport, so
Okay.
apologies if I drop off.
No problem at all.
Weird reason.
I'm gonna pull up the slide for the operations group, and then I'll pass it over to you.
Great, thanks.
All right, go ahead.
Okay, so the big news and update for the operations working group is that we officially have our memorandum of understanding signed with the BC Lung team. So we are good to go in terms of them formally acting as our fiscal host and also providing additional in-kind contributions to supporting the growth and success of Stop TB Canada. Another really exciting piece of information is that we have a specific donation page on their website now. So we can start circulating that, and we'll do so soon to get public donations coming in for Stop TB Canada, so we can fundraise our own funds to ideally be able to hire some of our own in-house team to support with secretariating alongside me and others, and also to work on various projects once we do have some funds. So in terms of fundraising, the idea right now is we will do a social media campaign, and we'll also be putting out the link to donate through our newsletter on the next newsletter, and we'll do direct outreach to all of those who have seen the work of Stop TB Canada over the last number of years and presumably appreciate it and might be willing as individuals to make some sort of contribution. So we'll start there, and then we will be planning some sort of public event alongside the Hill Day on September 25th, maybe the night before, maybe the night of, I'm not sure. We'll figure it out. but we will host an event that is a ticketed event, and the funds from that ticketed event will come to Stop TB Canada. So yeah, those are the main big updates from the operations working group. We're really excited to see this come together and looking forward to seeing how much resources we can raise. Anything else that I might have missed, Petra or Lee?
I think those were the main things. I did have one thing on my to-do list for today is to follow up with TB Vets. The contact that Elizabeth put us in touch with was on vacation the past couple of weeks. But I think Elizabeth had an initial conversation with TB Vets at the NAR conference about potential support for our network. So I'll follow up with them and we can get a call in the books and see how they might be able to support us. Anything else, Petra? Okay. Perfect. Okay, sorry, I'm just, oops. Okay, trying to multitask, talking to our guest speaker about coming a little bit earlier, but let me just move on for now. Okay, so we have touched a little bit on our Lead on TB campaign and some of the events that we're planning in September. So let's dive into what that means, the Lead on TB campaign. Basically, the Lead on TB campaign will pull together all of our kind of the main asks that we have across global and domestic, what our priorities are for the government. And I did include our draft list of asks when I sent the agenda around for this meeting, but I can recirculate that and would welcome all of your feedback. Right now, our main asks that we've included are to ambitiously support the Global Fund's 8th replenishment, meet the fair share contribution for TB research and development, support the challenge facility for civil society, and fund a national TB elimination strategy. And basically, this will be the basis for like an MP leave behind. So when we have this TB Hill Day, after we meet with MPs, we'll give them like a 2-page document that kind of summarizes what we're calling for. And these asks will be the basis of that document. So it will be basically a paragraph on each of our asks to explain exactly what we're calling for. So I'm really looking for feedback, especially on the domestic ask. I know we don't have a financial ask really associated with the National TB Elimination Strategy, but I think in previous conversations we talked about asking for this National TB Elimination Strategy to be funded so that it can move from a time-bound task force or whatever it's called currently to something that's a bit more sustainable and would have a bigger impact. So I see, Petra, you have your hand up, so I'll open up for feedback on the asks now, and the document will be open. I'll give you a deadline via email after this call, and you're welcome to provide feedback in the document as well. Petra?
I think this is amazing, Lee, and it's such a great timing to put a Lead on TB ask forward. I think what you have here is an excellent start. I definitely will go into the document, and I have some suggestions on how we can have some broader languages for our global partners. There are several other global partners that are important to Canada, especially linking to the broader discussions where Canada is leading related to the Lusaka Agreement, health systems related work. So we might want to give a bit of a broader context so that even if they choose to work with other partners on health, that we can insert TB in those. I think we should put a number 5, that is Stop TB Canada, fund Stop TB Canada. And even though I think the National TB Elimination Strategy will be hard for us to put a financing figure because that is not necessarily led by us, that's more by PHAC. We can ask PHAC if they have a financing figure that they want us to help advocate for. But in general, I think also Courtney's paper, Courtney and Abdul have done a great paper on the financing, and to give some more high-level numbers in there of where we need to go towards 2030 and towards 2035 in terms of eliminating TB would be super helpful in this Lead on TB ask. So giving some kind of meat to what an investment case for TB looks like in the next 5 to 10 years will probably resonate with this current government. And I think if there's any kind of figures that we can get from the Inuit framework or from any other, the TB elimination working group that we can help them to advocate for, we should use those. In addition, I think we should put at least like 600,000 for the next 3 years for Stop TB Canada in there as well, as a sort of, we are that network that can support to advocate towards and coordinate in terms of professionals. The whole international global link is a good opportunity to put that in there as well. So that would be my call.
Thanks, Petra. Ekta?
Yeah, I mean, great work on this, Lee. Just like on the Stop TB Canada ask, Petra, I don't know if, I mean, again, we can have side conversations with them, but putting that in an official document when we're talking about broad, like we're talking about global, we're talking about civil society, it's just like, again, a bit conscious of the number of us we are going to them with, especially when they read the brief, like what is like the one takeaway for them? You get what I mean? So I just feel like we also need to be conscious of the number of us we go to MPs with. But again, I think there's a good opportunity for us to have a conversation on the side with folks and like introduce Stop TB Canada and talk about like the funding bit. But I'm not sure about including that with the official document with MPs.
Thank you for that feedback, Ekta. Yeah, we can figure out what makes the most sense in terms of the Stop TB Canada fundraising ask, if that's part of our package or if that's potentially a separate call, and we could have our pitch documents and meet directly with the targets and potential funders. But we can definitely continue that conversation. Robin, did you have a thought on that?
Yeah, sorry. Takes me a minute to get off mute here. Just wanted to flag that I think it could be, again, I don't know the direction Canada is going to go, but there is still interest within Global Affairs Canada to look at a TB set aside. And so as part of that set aside, say it's, I don't know, like maintenance pledge to the Global Fund plus like another 150 million for TB specific mechanisms. Within that, there for sure could be scope and room, I think, to maybe behind closed doors or maybe publicly advocate for some funding coming to Stop TB Canada. Like I would think 600,000 over 3 years, so like 200,000 a year, like that's not a lot of money, but it would really help us get going as a network that's funded. And we could kind of pitch to them that we will help them with knowledge translation and disseminating of lessons learned from their investments abroad at home for the domestic response, and also raising awareness about the impact of the investments Canada's making in the TB response abroad. So yeah, I feel like it's worthwhile to try and squeeze it in as part of a TB set aside if that's the direction GAC's going to go. Maybe we don't say it publicly, but we have those conversations behind closed doors, and it would be good to kind of align on that as those discussions are happening now, from what I understand.
All right. Ekta?
Yeah, Petra, just to your point, like, I mean, we're not just talking about GAC, right? This brief is for MPs as well. So we're not just targeting GAC for this. So I'm talking about like, generally like going to MPs with so many asks, I don't know if that is like super strategic. It's like really leading into what the needs are right now. So basically, I mean, I was thinking like 3 main asks. One is like global, the R&D piece, which is like global and domestic combined, and then domestic. So even like 4, I feel is a lot.
Okay. We definitely have some time to refine this. And the Hill Day it's not just Stop TB Canada, it's a few different organizations, so it'll probably be a negotiation. So to have something specific for Stop TB Canada might be challenging if there are other organizations who are involved. So we do have a bi-weekly meeting now with a few of these organizations, and we're going to be talking about these asks. If anyone's interested in joining that, it's open. I think Petra and maybe a few others have those calendar invites. If not, I can get them to you, and we can continue talking this through. But basically, as Ika was saying, this will be the basis for an MP leave behind. So this is what we'll probably have half an hour with an MP to talk about what Canada can be doing to address TB. So we do have to be pretty tight with our asks, but we can definitely keep that conversation going. Okay, so that will be the key messaging that we can continue to refine. In terms of the events where we'll be talking about this messaging, so far we have a parliamentary reception, which Results Canada is hosting on the evening of September 24th. So that will be very similar to the parliamentary receptions that we posted in the past, where it will have MPs, advocates. It'll be open to anyone who wants to attend. Any of you are welcome to attend, and bureaucrats, GAC, Public Health Agency. We'll definitely circulate that with all relevant departments and hopefully have a great turnout, so they can kind of mix and mingle with a bunch of folks and talk about our TB priorities. We'll have a few guest speakers, and then basically how it works is we'll have hosts of different MPs from the various parties talk about TB. So that will be on the 24th. The following day is our TB Hill Day, so that will be a full day of MP meetings. Like I said, that's being planned with a couple of different organizations that you can see on this poster here. So TB Fighters, which is John Green's network. I think I mentioned on a previous call that John Green is not able to make it to Ottawa, unfortunately. But there is the possibility of having him help with some promotion, maybe create a video, for example, or even a video for the parliamentary reception addressed at MPs. So we're still kind of working through what's possible. PIH, Partners in Health, is our main point of contact for John. MSF, Stop TB Canada, Results Canada have all kind of dipped their toes in this event. So we'll be continuing to work together and share across all of our channels to hopefully get a really great turnout. We did have like an initial interest form going out, and we had over 100 people fill that out. So we'll see how many people are actually able to make it on that day, but it was a great indication that there's lots of interest in such an event. So Results Canada is going to be leading on the MP scheduling, and basically you'll sign up, you'll indicate your postal code, language preference, all of that, and based on expertise, jurisdiction, all of that will match you with an MP. And then in addition to this MP leave behind that we'll have our ask, we'll also have a very thorough briefing document for all participants, which will give more information about what exactly we're calling for, the type of messaging that might resonate with MPs, some of the questions that you could expect from MPs and how to answer them. All of that information will be provided, and we'll also provide a briefing session for everyone who will be participating. So hopefully a lot of Stop TB Canada members can join for that. Robin? Are you trying to unmute, Robin?
Yeah, sorry. On
No
the
problem.
phone's not easy. I'm just curious, what will our asks be? How will we present our asks that day? Yeah.
So our asks will be like the lead on TB asks that were on the previous slide.
Okay. And will we say anything about a TB set aside, or we'll say like invest in the global fund and invest in additional TB specific mechanisms in terms of the global ask?
Exactly. It'll be the latter.
Okay.
So it's kind of up to Canada whether they want to lump that in with the Global Fund or if it's separate, but we're still calling for like both of those things.
Okay, and we'll call them complementary and additional and not say anything about a TV set aside and let them do that if they end up wanting to do that.
Yeah, and hopefully by then
Gotcha.
we will have a sense of if Canada is going to do a TV set side. But for now, we're just kind of outlining like total. We want all of these things to be invested in, and we'll see how they decide to do it. Okay. And then lastly, we're hoping to, I think, as Robin mentioned, add on some kind of Stop TB Canada specific event, probably a fundraising event of some kind, and hopefully get some donations now in our new BC Lung banking account. Okay, so any other questions on the Lead on TB events, asks, parliamentary engagement? One thing to note is I will be drafting a template MP email that you can all use to send to your own MPs to tell them about these events and encourage them to go. So that will be an ask of all steering committee members in September when MPs are back from the summer break. Okay, great. And I see that our guests just joined, so that's perfect timing. Maybe before we pass it over, I'll just see if anyone has any questions or anything to add from the conversations that we've just covered in the past hour. Okay, amazing. Great timing. Welcome, Erica and Maria. Feel free to introduce yourselves. I'm not sure if you have slides, but you should have access to sharing your screen. If others want to introduce yourselves in the chat, that might be an effective way of not taking up too much time, but also welcoming you to the Stop TB Canada Steering Committee meeting. Over to you.
Thank you, and thanks so much for having us here. I'm also going to ask my colleague Maria, who I think is on the line, to just say a quick hello so you all can see her too. I know sometimes people don't pop up on the screen until they're talking, so Maria, if you want to just do a quick intro for yourself too.
Yeah, for sure. Thank you, Erica, and thank you, Lee and Petra, for having us on this call. And hello, everyone. It's very nice to meet you all. My name is Maria. I work with the Research Institute at McGill, and right now I'm working very closely with Erica to curate a CAB, which is actually why we're here today.
Great, thank you. And I know some of you, my name's Erica Lessem. I'm a relatively recent arrival to Canada. I'm originally American. Please accept my apologies on behalf of the American people for everything that's happening in global health and TB. But it's really nice to be with you all. I'm now based in Montreal, and I'm working with Maria and the McGill team on a trial that's called Starlit. And as Maria mentioned, we're working on building out community engagement for that, and really happy to speak with all of you and have some requests for you to help to this effect. So I thought it would be helpful to just start out with like a quick overview about the Starlit trial, since I'm guessing not everybody is familiar with it. This is a trial that recently started recruiting, like just a couple weeks ago. It's led by McGill, but there are study sites all over Canada and then also in other parts of the world. You can see here also trial sites in Benin, Brazil, Indonesia, Philippines, and Vietnam. And the goal of the trial is to come up with better treatment regimens for latent TB or for TB infection. And looking at shorter treatments, but it also is taking a really person-centered approach about thinking about what outcomes are most important for people and recognizing that shorter isn't necessarily like always the most important thing. We also want to make sure that the treatments are super safe and that they're easy to tolerate, and that so there's also going to be a lot of acceptability research that's done as part of this phase 2 trial. And as you can see here, the trial has a couple different stages to it. So in this first stage, it's looking at 2 shorter regimens for TB preventive therapy, one doing 2 months of a higher dose of rifampin, and then one experimental regimen that's just 1 month of combining levofloxacin and rifapentine. And then the trial will also, in the next stage, be thinking about adding some more other regimens that are kind of coming down the pipeline. And then this is the phase 2 trial, but when the trial has results, then there will also go on to have a bigger phase 3 trial. So it's kind of a series of different stages and phases to the trial to get at this answer about like what's the optimal or what are some improved options for treating preventive therapy, which I think you all know is really important in Canada. So as part of this work, we want to build out a community advisory board, obviously to like help guide and give input into the Starlet trials themselves. But also the idea is to build like a Canadian CAB that could be available for other trials as well. So it wouldn't be specific just to McGill, it wouldn't be specific just to this study, hoping that we can get really good representation across the study, across the country, and that this could be a resource for other research in the future, but also like, you know, I think we all have our advocacy hats on, and I think that this could be a group that we hope to empower once they're together and kind of built to support their empowerment over time, to really engage in like policy advocacy and uptake of results and things like that as well. So this is just to give you a sense of the kinds of activities that we're hoping the CAB can be involved in, starting out with just building their capacity. We are expecting that CAB members that are coming in won't come in with a lot of knowledge about TB and definitely not about how clinical trials are conducted. So kind of onboarding them to be able to engage really meaningfully. The goal, the kind of initial goal is to get their input on that kind of first decision point that's coming up in a few months about what other regimens to include. So we'll be kind of driving some of the training towards that. There's going to be opportunities to collaborate with international sites. And as I mentioned, hopefully over time, also building out their interest and ability to engage in like policy advocacy as well. So we're taking a couple different tacks to the approach for building out the Canadian CAB, and I wanted to just give a couple kind of top line pieces of information here. We are picturing that the CAB, since it's going to work across Canada, will work in English. So that is, doesn't need to be like super fluent, but as long as people are proficient in writing and reading and spoken English, that will be a requirement. They will be compensated for their time modestly. There will be a $30 per hour honorarium. We're expecting, you know, anywhere between like 3 and 10 hours a month of engagement. And working mostly on kind of giving input into the overall approach to the study, but there might be some site level engagement too. And then for the first stage of recruitment, sorry, hold on one second. Let me just get a little bit of water. For the first stage of recruitment, we're focusing on populations that are going to be most likely to be recruited for the trial, like at the study sites. So you can see here we have 7 different cities that have sites across Canada. And then we can also have some national representation too. And for this kind of first phase of recruitment, for the CAB, we want to have the CAB reflect who we think are going to be the majority of that study population, which is really like people living in urban centers, which tends to be people who are born outside of Canada from high TB burden countries. We could also, we welcome people who are TB advocates and survivors themselves, survivors of, you know, LTBI too. It doesn't have to be active TB. People who've cared for someone with TB, whether that's like a family member or a frontline or community healthcare worker. We would love to have nurses, public health workers be included in this. And then also other affected groups, like people living with HIV or people who are unhoused or incarcerated are obviously at higher risk of TB. I think there are some challenges potentially for them participating directly in a CAB. So, you know, maybe targeting groups that work with unhoused people or incarcerated people. These are some of the kind of populations that we're thinking about trying to target with outreach this summer. We know that summer is like maybe not the optimal time, but since the trial is starting, we want to make sure to start including community perspectives as soon as possible. And you might have noticed like an omission in the previous slide. So we want to make sure too that we have really strong Indigenous representation, since that's such a key affected community by TB in Canada. We wanted to take a slightly, the trial team decided to take a slightly different approach to the engagement of Indigenous groups, partly because this timeline is a little bit rushed for getting the CAB up and running, and we want to do it in a much more kind of participatory and co-development approach. So the engagement of Indigenous communities is going to have a slightly longer or a longer timeline without like a, kind of clear end date for building a CAB. And we also want to hear from members of representatives of Indigenous communities too, like what the best approach is. Is it having a nominee to be a member of a CAB? Is it forming a separate CAB, or is it a different approach entirely and like consulting with existing structures that exist in some of those organizations? We've heard that in a lot of the Inuit communities, for example, that like bandwidth is really tight for engaging in this kind of stuff. So rather than asking them to come join our CAB, it might be better to just consult with some of the existing structures that are already in those communities. So just wanted to flag this to let you know we are thinking about this very intentionally, and it's not a group that we're excluding. It's just trying to have a really thoughtful approach about engaging Indigenous partners. So more on that soon, but would welcome your feedback on it. So this is just to give you an overview of the timeline. So the call for expressions of interest has gone out, and we would love to ask for your help further circulating it. We have a kind of optimistic timeline of August 4th for expressions of interest. So basically applications for CAB members to be due. But I do want to note we can be somewhat flexible with that to make sure that we get like good representation and turnout. There will be a selection panel comprised of a few different representatives from the study team itself and also from Stop TB colleagues. So shout out to Elizabeth and Robin who've agreed to be on the selection panel. Thank you so much. We'll let the CAB members know. And then the hope is that by September, we can start onboarding the new CAB members. And also at the same time, once summer is over, we think that'll be a good time to start reaching out to Indigenous partners and kind of thinking through with them the best plan for building out community engagement in their communities as well. And then in the fall is when we'll start doing trainings and capacitation for engaging in the Starlet trial. And then coming up in the winter is that first kind of decision point I mentioned about which regimen is going to move forward into the next stage. And we're hoping, as I mentioned before, this CAB will continue not just through the Starlet trial, but like be available for other engagement as well. So this is the flyer that Maria helped develop. Thank you so much, Maria, to call for applications or for expressions of interest. And this QR code links to the full call for expressions of interest, which has a lot more detail. And I think, Maria, if you can drop into the chat the link for that too, so people have easy access to it, that would be great. So we would love to have your help circulating this call. If you think there are groups or places that we should reach out to directly, we would really love to hear from you for this. If this is appealing to any of you, we would welcome you to apply as well, and would also love to open it up for your input and feedback and ideas for kind of this staged approach to how we're thinking about engaging Indigenous communities. And also, I know many of you work in these communities, so when the time comes for that, would also love to ask you in advance for your support with that. So let me pause there and see if there are any questions or feedback for us.
I have a question. I'm wondering if there are any Indigenous people on the research team.
That's a good question. I'll have to look into that. I'm a consultant with the project and relatively new with it, so I don't actually know the whole research team. So I'll have to look into that and get back to you on that.
Okay, that would really help with recruitment of community members.
Yeah, that's a great point. Thank you. And I want to mention too, if it wasn't clear, like there are also, there's this first phase of the trial, and then the phase 3 is going to be much larger and include more study sites as well. And I think the hope is that, at that stage too, it'll be expanded from just kind of some of these urban center populations and maybe actually conducting some research in the Indigenous community, in some Indigenous communities themselves, but, going through all the proper consultations and ethical channels for that. And I saw in the chat, I'm so sorry, someone noted that the QR code doesn't seem to be working, so we'll double check that. And if needed, we can update that and send that around to the group by email afterwards. Thank you for flagging that. And I'm just seeing, is it Lena or Lena? Sorry if I'm not getting your name
Yeah,
pronunciation
Lena,
right.
no worries.
Lena? Okay, thanks. I've heard a lot about you, or I've read a lot about you in email.
Yeah,
but
you too. Nice to see you.
Everyone was saying you should definitely be one of the people we talked to too about the Indigenous recruitment step. So great to meet
Yeah,
you.
I think it was more the incarcerated population. But
Oh, okay.
yeah.
Sorry about that. Yeah.
Yeah.
So yes, living in Canada, that's right. And McGill has a TB cab, so thank you for pointing that out. And there will be some linkages.
Okay.
We've asked Tenzin, who I believe is part of the McGill TB Center cab, to kind of sit in on a lot of the Canadian cab activities. But yes, the goal of this group is to build out Canadian community engagement capacity. So living in Canada, for joining the cab, and then for being part of the study, either receiving care in Canada or in one of the international study site locations.
Right. Okay.
And I should mention too, like, as part of the interest in including perspectives of people who are born outside Canada, I think our hope is that people can participate in the cab for like at least 3 years, which is around the kind of first phase of the trial timeline. But we know people's lives are complicated, and like, especially for people who, might not have permanent residency or things like that too. I think it's not a hard and fast rule, but, generally people who have the intention to stay here for at least a few years is kind of the target population for the cab itself.
Okay, that makes sense. Thanks.
Yes. And sorry, I think I saw another hand, but then it disappeared. So if feel free to just come off mute if you have any other, if anyone else had a comment.
Uh, Sorry, it was me. But then I opened the link and I started reading in it. Correct me if I missed that in the presentation, but you were looking for people who are in urban centers, right?
Yes.
In this first phase.
Yeah. So let me go back to this slide here because I ran through it kind of quickly. So we have sites in 7 different cities. So that's kind of like we're hoping ideally to get a cab member representative from each of these locations. But we could also we're also thinking to accommodate 2 or 3 additional representatives who might not be tied to one of those study sites. So someone from a national group that's like working with one of these key populations would also be welcome, even if they're not directly affiliated with a study site location.
So, but how does that then the inclusion of indigenous populations that might be outside of the urban centers, where there's a high burden, how is that integrated into this?
So that's going to be like a second stage. Of course, if anybody from like an Indigenous community is interested in applying in this first stage, they absolutely could. And if they're not at one of these sites, they could be at considered for one of those additional 2 to 3 spots. But then, there's going to be this second phase that is much more directed towards Indigenous communities and won't kind of hit that same, like, I don't want to say quota, but like our goal for the geographic representation. This will be a much more open-ended approach, hearing from the various Indigenous community representatives themselves about how they think the best way to approach this is and what structures could look like. So we would welcome applications for people to join this kind of phase, this first stage cab, but there are also going to be other avenues and opportunities for engaging Indigenous communities with a more open-ended timeline and not as kind of constrained in terms of having some tie to the sites.
Thanks.
Yeah, thank you for the opportunity to clarify. So I don't want to take too much of your time, but we really appreciate the opportunity to present this idea and would love to work with all of you. If you are able to help circulate the call, we would really welcome applications. If you know of anybody good that you want to reach out to personally or want us to reach out to, or just, listservs that you think we should blast this off to, that would be great, especially Maria is newer to the TB field. I'm newer to Canada. So we would really love to have your help kind of networking and getting the word out there. So thank you so much. And thanks, Lee and Petra, for the opportunity to come today. And thank you, Robin, for all the help to make this happen and to connect me to the team in the first place.
Thanks so much for joining. Yeah, just to speak quickly to Amplifying Through Stop-TB Canada, it has been shared on social media. But if you do create a new QR code and you have an updated poster, feel free to pass that along and we can share the updated version. And then I do have a slot for it in the upcoming newsletter, but just noting it, our newsletter does go at the last week of each month. So I'll put the August 4th deadline and we can try to push it maybe a day early, but it will probably be July 29th at the earliest that it would go out. But we'll definitely include that, and that gives at least a couple of days for people to submit their interest.
Okay, great. Thanks, Lee. And I think we can definitely, when we send you a new version with a new QR code, we can also send you a version with a slightly extended deadline just to give people a little bit more time. Yeah.
Yeah, that would be great. Yeah. Perfect. Okay. Well, if anyone has and thinks of any questions or wants to get in touch with Erica and Maria and the team, feel free to reach out and I can connect you all. But thanks so much for joining. This is a great project and we're happy to support in any ways that we can.
Thank you so much, everyone.
Thank you. Have a good weekend, everybody.
Have a good weekend. Okay. So I know a couple people hopped off the call and I'm hoping to join Kins's presentation as well. So it worked out. We're running through the agenda pretty quickly, but I just wanted to see if anyone had any other agenda items. The one thing that I did miss is I think a couple of months ago, maybe last month, I shared a draft pre-budget submission on behalf of Stop-TB Canada for feedback. The deadline to submit pre-budget submissions is August 1st. So I'll recirculate that in the notes after this meeting. And if anyone wants to provide any feedback, that's basically a list of all of our financial asks, what we want Canada to invest in. And so we'll share that around for feedback. Other than that, I think that about covers all the agenda items I had, but just wanted to see if anyone wanted to bring anything else up if we missed anything. Okay, amazing. Thanks so much for joining. Enjoy your weekend and the rest of the summer, and we'll see you online and in various meetings. Thanks, everyone.
Thank you, Lee.
Bye.
Thanks, Lee.
Thank everyone. Have a
Bye,
nice
everyone.
Bye, everyone.